Hi, so today I'm going to be talking about generalized anxiety disorder. My name's Haley Harris, and this is my final project for SPED 158. Let's first start out by talking about anxiety. So, anxiety falls under the emotional disturbance category for IDEA. The emotional disturbance category means a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. So the characteristics are an inability to learn that can't be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, and a tendency to develop physical symptoms or fears associated with personal or school problems. There's different types of anxiety. There's separation anxiety, phobias, social anxiety, generalized anxiety disorder, and also panic disorder. Today, my focus is going to be on generalized anxiety disorder, which is a lot of worry or fear with no real cause. So symptoms would be feelings of fear, worry, anger, or irritability, trouble sleeping, fatigue, headaches, and stomach aches. So these might be hard to see in children and can look like something else. A lot of the times anxiety can be misdiagnosed as ADHD or even bipolar disorder. There's not one true cause for generalized anxiety disorder. Usually manifests in worry that doesn't have a real cause. But some causes of anxiety would be trauma, genetics. So if your family history has anxiety, then you might be predisposed to it. Brain chemistry, so chemical imbalance in the brain. Life situations. So if a student is living in a homeless shelter or has parents that fight, that might contribute to anxiety. Also learned behaviors. So if your parents have anxiety and have certain behaviors, you might pick up on those as well. All right, so it presents in children and adolescents as fear or worry. Some students might be angry or irritable towards their teachers or peers. Also, it could come out as complacency. So you wouldn't see any symptoms. The student would just, you know, do their work and get done with school, but be feeling anxious inside. Also, the refusal to attend school and clingy behavior. Finally, lack of concentration and the inability to relax. So that would greatly affect their school performance. It's diagnosed by first going to a doctor visit and having a physical check. They do the physical check so that they can see whether or not their symptoms are a result of a physical illness before they go into the mental health assessment. Then there's going to be a mental health assessment by a trained therapist where they do a complete emotional and social history. So they check for family history of anxiety, maybe past traumas that the person might have had in order to diagnose that. Some treatments include medication, so a daily dose of anxiety or antidepressant medication, or even a lorazepam for panic attacks. Cognitive behavioral therapy focus on taking negative thoughts and turning them into positive thoughts. It works with people on how to better react to different situations so that they can better manage their anxiety. Also, things that could help are dietary changes, more physical activity, sufficient sleep, predictable routines, and social support. Some herbal treatments that are not accepted by the medical community are kava, passion flower, lavender, and chamomile. They're said to help reduce anxiety and give a relaxation feel, but they also come with multiple different side effects. Anxiety affects the student's ability to learn. Lack of concentration, they might have high number of absences that can cause them to have a lot of makeup work that could then turn into more anxiety. Some students have test anxiety. They might have poor relationships with peers and teachers, trouble with their memory and retaining information because they're so focused on their anxiety and their worry that they can't retain any new information. Also, avoidance. The student is worried about an assignment, they might just avoid it altogether so that they don't have to feel that worry. There's multiple different supports that we can use in the classroom. So we can provide emotional support by giving them encouragement, self-calming objects, and mental health breaks. We can allow them to have preferred seating, create a plan for their absences and makeup work, and also give advance notice when there will be a change, such as a substitute teacher, and then give them transition times between activities. For instructions, set clear guidelines, spoken and in writing, and allowing the student to present a project to the teacher rather than the whole class. Finally, to break down assignments into manageable chunks. For testing, we might help them out with a quiet testing environment in another room with a proctor. Give them extra time, usually it's time and a half or 2 times the amount of time. Because they have trouble with memory and retaining information, you might allow them to have note cards with certain facts on there that they can use to recall information. And then finally, provide advance notice. So don't give them pop quizzes. You want to let them know when they have a test coming up so that they can best prepare and feel less anxious about it. Now, these are not all the supports that can be happening in the classroom, and you really have to look at the individual student because it's all about what helps them learn individually. So thank you so much for listening to my presentation. These are my sources, and that's it.